You're listening to Psych with Mike. For more episodes or to connect with the show with comments, ideas, or to be a guest, go to www.psychwithmike.com. Follow the show on Twitter @PsychWithMike or like the Facebook page @PsychWithMike. Now, here's Psych with Mike.
Will you mansplain that to me?
Welcome into the Psych with Mike library. This is Dr. Michael Mahan, and I'm here with my good friend and colleague, Mr. Brett Newcomb.
Yeah, the question is, did I get you?
Uh-huh.
Oh, good. How are you this morning?
I'm
You're
okay.
chagrined.
I don't know how to answer the question because I don't want
Yeah.
to appear to be condescending.
Why would that stop you now? What's different about that?
Well, because now you've put me on notice.
Okay.
Yeah. Do you want to talk about that?
My wife and my therapist listened to our podcast, and they said your primary way of communicating was to mansplain.
Uh-huh.
And we were discussing whether that meant I was excessively feminine in my projections so that you needed to mansplain, or whether or not you were actually mansplaining.
Mm-hmm.
And you thought you were just being scientifically detailed and accurate to the nth degree.
Mm-hmm. Yeah.
And I had no comment.
Well, it started because I was talking to you about
photons on Alpha Centauri.
No. Quantum entanglement.
I don't believe in that. Emotional entanglement, I can deal with that all day long. The whole quantum thing.
And the difference in the presentation of photons as either waves or particles.
Can you see my eyes glazing over already?
Yeah.
Okay.
Yeah. So.
All right.
So I'm not. So now that I'm.
So look at the camera and say, Phyllis, I'm not mansplaining.
I'm not going to do that because that would be condescending.
No, that'd be a direct communication that wasn't.
Well,
therein lies the problem.
Yeah.
Let's do some cognitive behavioral therapy about that.
Okay. Did you want to start?
Well, you have some inaccurate thoughts that we need to challenge, or negative thoughts.
I don't know if I do.
Oh, yeah. Well, there you go.
I feel like I'm being told that I do, but I didn't know that prior to your disclosure.
You didn't? No one's ever mentioned that to you before? So you're much too intimidating.
That I'm was mansplaining to him?
Yeah.
Well, I think that we both know a certain clinical director that probably used to tell me that all the time. So I guess the answer is yes, people have said that to me before.
And your processing of that was somewhat dismissive?
So not, probably yes, but not, I don't think in a malice way. What I have...
You don't have to be malicious to be dismissive.
Well...
You have to care enough to be malicious.
Yeah. What I have come to the conclusion of is that it would be extremely difficult for me to change that. I would have to become foundationally a different person.
Oh, I use that excuse all the time because I'm so old. I have too much baggage.
And I don't want to do that. I don't want to be a different person. So then the question is...
I just remember what Stuart Smalley.
Yeah.
People like me.
Yeah. I'm good enough. I'm smart enough. And doggone it, people like me.
There you go.
Yeah. Yeah. So... I don't know where to go with that from there.
There probably is nowhere to go. Let's just cut to the chase.
So I had sent you some topics for today, and one of the things that you have reminded me of and that I agree with is that if I just run down my own rabbit hole, then I will kind of move away from a strictly clinical presentation of what we do here, and that we want to try and remain more focused on that. So I sent you some topics that I thought were very clinically based.
They were, absolutely.
Yeah, I hope that you agree with that.
I do.
Good. All right. So today we are going to talk about something that is fairly common and is probably the way most people today, excuse me, if they have accessed the mental health system, they have been exposed to something called cognitive behavior therapy.
Yeah. And one of the questions, and I'll ask you in a moment, I'll ask you to, because you get such joy from it, to define it and explain it. But one of the questions that I think is reasonable when you frame the conversation that way, and you say, well, if people today access the mental health treatment protocols, this is probably where they found a portal, is that we've both been practicing therapists for nigh on to 30 plus years. And in that time, there have been intense discussions within the field about the efficacy of long-term talk therapy versus short-term topic-focused specific interventional therapies. So that if you come to see me for anxiety issues because you're afraid of spiders, if I work with you on reducing your fear of spiders, and we don't look any further than that or more deeply into your makeup or your experiential world, then that's all that the healthcare system ought to provide and your insurance company ought to pay for. So a lot of the services that are provided today, I believe, mine, are tailored specifically to receive remuneration reimbursement from third-party payers. So you have to come up with a diagnosis that they'll accept. You have to come up with a treatment plan that they'll accept. You have to accomplish your objective within a window of time that they define. So who's driving the bus? Is it the insurance companies? Is it the therapists with the training and the licensure? Is it the therapeutic organizations that say this is what you have to do in order to be ethical or legitimate? And that's one of the conversations we have. It never seems to go anywhere. Reality is this is the way the system works. And so those of us who practice clinically have to be aware of it and have to have a response for it when people ring the phone and say, can I come talk to you about something?
And just to even build on that, when I was in graduate school, when I started graduate school, it was not a requirement to take a brief solution-focused intervention class.
Right.
By the time I graduated, it was a requirement.
It was almost the only thing they offered.
Yeah, and that was specifically a class that was required to get into insurance pools, to make yourself eligible,
Right.
to be attractive to insurers so that you could join their panels and get reimbursed by them. But you then also had to do it according to their defined parameters.
Well, yeah, you have to be licensed, and you have to have 3 years of clinical experience after licensure to be eligible to get on the panel. Well, where are you supposed to get experience? Well, go do the job. Where are you supposed to go do the job? Be licensed.
Right.
Be on the panel.
Right.
You can't get on the panel. Well, you can if we narrowly define the window. If you only treat adolescents, if you only treat military veterans, if you treat PTSD survivors, whatever population group that's putting a lot of demand on us for payment, you have to be certified in the treatment of that, and then we'll make an exception. If you don't have the full-blown 3 years of universal experience, but you have 6 months of treating PTSD, then we'll put you on our panel and refer PTSD cases to you.
And so we want to be clear that the artifact culturally of this movement towards cognitive behavioral or brief intervention therapies really didn't start until at the earliest, the late 80s, really didn't gain momentum until the 90s. And these modalities existed before that. Albert Ellis wrote Reason and Emotion in Psychotherapy in, 1964, 65, somewhere in the mid-60s. And that was one of the first Bibles of what we now call cognitive behavior therapy. But at its roots, cognitive behavior therapy is simply a belief that if we have some irrational or troublesome thoughts and we repeat those to ourselves over and over, that's going to have a direct impact on our emotional state and effectively then the way that we behave, which is true. I mean, that's just a factual statement, right?
I agree, and I think that complicates the discussion, which always requires you to define your terms and figure out what it is you're talking about. Because we were talking about how does a newbie coming out of a graduate program get themselves able to earn a living without having to work for an insurance company or a hospital or an agency. Those are standard entry paths. And the universal requirement, at least in our field, we are licensed professional counselors. You can become a licensed professional counselor in all 50 states. But in order to do that, the standard for licensure and approval is the exact same in all 50 states. You have to take the same courses. You have to have the same experiential observational training. You have to have the same internships. It's all standardized. There's no backdoor, oh, I was doing this 10 years before the licensure law, so let me be licensed and I'll just keep working, which the other domains in our field allow or have allowed in the past. So then the question becomes, are you talking about how to do business, or are you talking about what constitutes good therapy? And I think we're trying to do a straddle. I think there are elements on each side that have legitimacy and need to be discussed in terms of how are they legitimate. Cognitive behavioral therapy works. Why does it work? And the belief that we have absorbed in our evolving as human beings, as people, from being a tabula rasa baby to being the adult. We have internalized messages from our families and our systems that are often inaccurate. They're family myths. Alcoholic families have a million of them. And if I grew up in an alcoholic family, there are certain scripts that I internalized about the looking good family, about the role I have in the family. That's my job. That becomes a burden that limits my options, so that when I move away from my family of origin and get out into the larger community, I look for subsets that allow me to step right into that role, because I can wear those clothes, I can talk that talk, I am comfortable, and I am functional, and I have a value to that subset community. But it may mess up my relationships personally, it may mess up me personally. I may be carrying a lot of pain and baggage because of that inaccurate, unworkable script. So cognitive behavioral therapy helps me identify those thoughts that I have that are less than accurate, and it helps me rewrite a script. So I always work with my clients in terms of saying, you have a script that's been written for you, and you can read it all your life, and nothing will ever change. And all these things that happen keep happening. You may get a new job, you may have a new marriage, you may move into a new family, but the same things will start to happen, and the same predictable pattern will evolve. If you want to change that, you start at the beginning. You identify the negative thoughts that you have that are inaccurate, and you replace them with a script that you embrace coming out of who you are from your own internal sense of integrity. And in the beginning, you don't know what that is, because all you know is the script that you were taught. And so part of the job of the therapist is to invite you to identify that script, and then invite you to imagine a different script, and not feed you answers, not tell you what that script ought to be, because we don't want to become the new indoctrinators of a script that somebody internalizes. We want to say, look in the mirror, get in touch with your feelings, that rational emotive therapy thing, feel your feelings, and then decide, do I want to follow this script? Do I have to follow this script? I'm in this dysfunctional, multi-generational, sick family, and they're all having a family reunion, and I'm expected to go, and all the players are there, and all the games are played. Am I going to go? And will I get the traditional wounds that I always get whenever I go? Or can I say, no thanks, I'm not going. And then can I live with the consequences of that?
And for example, a rational or an irrational belief that a lot of people may have. This was the first irrational belief that I ever uncovered when I was working through graduate school. I came to this, what I thought was this epiphany, that people made me mad. And when this dawned on me, right, I thought I was doing really good work. Like, oh, people make me mad. That's why I'm so emotionally volatile. Yeah, it's because people make me mad. And so then after I kind of explored that, what I realized was that people don't actually make me mad. People may do things that I interpret and tell myself is horrible, can't stand it, and then I get mad.
People make you do things?
No, people do things.
Oh, people do
Yeah,
things.
and then
Okay.
I have a reaction to that where I say, that's horrible, that's terrible, I can't stand it. And then I get angry. But there's an...
I'll give you an
there's a-
example. Driving out here this morning, I have this conversation with you. I'm at a stoplight, car in front of me. Light changes, car in front of me doesn't go. Brakes are still on. The person is looking down at their phone, trying to find something on their phone. I want them to get out of the way. I blow the horn. They give me the finger. And we have this little tense moment of glaring expressions at one another. And then they slowly move forward to make the turn and to occupy the lane space. You have feelings in response to those situations. And you can blame the other people. My wife says to me when I encounter this situation, I mean, I drive a lot, so obviously there are a lot of idiots out there driving for me to encounter. And she says, you experience this a lot, and you're retired. You don't have any place you have to be. You're not in a hurry. Why is this bothering you? And so we have a conversation about it. And, why does it bother me? It bothers me because I'm impatient. It bothers me because it frustrates me that people drive and play with their phones. It bothers me that it's dangerous. It bothers me that they're in my way. It bothers me that they're inconvenient to me. So do I like myself for being that kind of person?
Well, that's a question. Let's go to our break, and we'll answer that question when we come back.
I already know the answer.
Hang on. Go.
Michael,
Yeah.
why should people listen to this show?
Because we have a dearth of both intellectual and professional experience. We've taught university.
dearth?
Yeah.
Is in an absence?
Dearth.
Dearth of means not much of. We're starving to
I thought dearth meant a lot of.
No.
Oh,
No.
well, see, that's why they should listen to the show, because every time you tune in,
One of us has a
you learn
vocabulary.
something. If it's Friday, it's Psych with Mike. All right, we're back, and so
The answer is yes.
that you like
I
yourself.
like myself.
Uh-huh.
Yes. And by God,
And you
people like me. Yeah.
You like yourself when you are that person, when you are the person.
Oh, no, that's an interesting qualifier. No, I don't like that part of who I am,
Mm-hmm.
and I work to reduce its.
But that was the
strength.
question that she asked you, right? Is
Yes.
that you're a retired guy, you don't have any place to be. Do you
Right.
like the person you are when you do that? But a lot of people would say, do you like the person that you are when that other person makes you that way, right? This is the thing.
Oh, yeah. Right.
This is the
No.
thing in therapy that I really try and
Yeah, their
help people
behavior
recognize.
offers me the opportunity
Yeah.
to get in touch with that, but they didn't cause it.
Right.
It was-
You
it's
still
there.
have to own the responsibility
They
for it.
tapped it, yeah, because it was already in there.
Right.
Yeah.
And so, for me,
I'm the same way about old people walking slow in the mall or drifting in the grocery store. I'm in the grocery store. I have a list in my hand. I'm trying to just go in and get what I need, and I try to stay on the outside of the grocery store and never go on the inside. But the grocery store, because they know I shop that way, as do many others, keeps moving crap around. So the bread was over here this week. It's over here this week. And then you get the old folks bus, Oats is what they call it here in St. Louis, drops people off from the old folks' house and lets them do their weekly, monthly, whatever shopping. And they're like kids set free at the circus. And they have no perceptual awareness that anybody else is around, that anybody else is shopping, that they're in the way, that they're not moving. And I get so impatient. And Phyllis laughs at me and says, you are one of those people. When you stop in the aisle to look at something, you claim the space. And you dawdle, and you are undirected. And I say, oh, no, I got a list. I'm doing what I'm going to do. I'm in a hurry. And she says, that's not the way the world experiences you.
right.
So then she challenges me to do the cognitive behavioral
But that's
work.
the old Jungian idea that all the things that you identify in other people that you don't like are
shadow
actually
self. Yeah.
pieces of your shadow. Yeah.
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 So I don't like my shadow, but I really like me.
Right.
Yeah, okay.
Yeah.
I can live with that. My
And-
shadow's nasty.
Now, I'm not going to respond. But going back to when I had this epiphany that other people make me angry, which really felt like it was significant. Like when this
It was an
happened,
aha moment for you.
Yeah.
Yeah.
And so then the question is, what do you do with that? When you realize other people make you angry, what do you do with that? Well, what ended up happening for me was that then I started thinking about, okay, how can I change that because I can't change other people. And that's where...
That's a hard lesson to learn.
Yeah.
Are you trying to teach people? If you tailgate on somebody
Right.
and you flash your lights and you blow your horn,
Yeah.
are you teaching them
Yeah.
to go faster? Are you
Right.
teaching them to get out of the way? Or do the opposite results occur? They slow down. They slam on their brakes. They try to cause you to ram them and so they can sue you if they live through it.
Exactly.
Not a rational move on their part
Right.
either. But what's the agenda? And what good is your behavior accomplishing? Mm-hmm. Those are great questions.
And so the way that I started working on this was when I was driving, I realized that I got really angry, as what you're saying, when I was driving. And at this time, I took a particular route where at one point I would have to get into the far right-hand lane to make a right-hand turn. And this, was a designated right-hand turn lane. And I would get really angry when people would be driving in the next adjacent lane and blocking my way to get into this right-hand lane so that I could make this right-hand turn. And what I then told myself is everybody else on the road has an equal right to be on the road, and they have an equal right to drive wherever they're going in whatever way they want. If that's inconvenient for me, then it isn't because they left their house thinking, I'm going to get that Mike Mahan today.
Yeah.
It's because I left in a time when because a lot of us want to use our cars like time machines. If it takes 20 minutes to get somewhere, we leave 15 minutes before we're supposed to arrive, and then we're going to make up the 5 minutes.
Yeah, absolutely.
Right. And so...
And that's another parallel to that is that you could choose to step on the brake and let that guy go in front of you. Mm-hmm. You just want to get in front of him.
Right.
Or you want him to get off the road so you can have his space. But you don't want to get behind him.
Yeah.
So
then when I realized, okay, everybody else has this right, what I then said to myself is, other people don't make me angry. Other people do things that I have a reaction to, and then I get angry. So I make myself angry.
So did you go through a pouting phase first?
Oh, yeah.
Because I'm a big pouter.
Yeah.
Or used to be. I'm much better now. But yeah, I'd get that first logical interpretation. Mm-hmm. Usually somebody would advise me of that. They have the right to be there too. And then I'd sull up and pout and radiate hostility.
And so then in cognitive therapy, what we try and do is to help these individuals, including ourselves, to be able to make a transition between this expectation that the rest of the world should somehow adapt to us and try and adapt ourselves to the world, right, to take responsibility. But initially what we have to do is to break the connection between those events and how we create this affective emotional state inside of us. And we do that through distraction techniques.
Well, that's the whole Albert Ellis approach. When people would say, well, why did this happen to me? And he would say, why shouldn't it happen to you? What is there in the universe that makes you unique and special? It's got to happen to somebody. Why shouldn't it be you? And so you can put all of your emotional energies into saying life is not fair, or you can cognitively recognize that there are other ways to interpret it and there are other paths to take if you have the intentionality and the will to take a different path. But that takes work.
Right.
Because
but you also
we're on
have
autopilot.
to, even when you're doing that work, though, one of the things that is really important is that people recognize that they can do things to break the connection between what those irrational thoughts are. This is horrible. This is terrible. Why is this person blocking my path?
Right.
And that affective state and the emotional reaction. And the way that we do that is through techniques of distraction, relaxation, deep breathing. Those are all things that we teach. For me, I used a distraction technique where I would hum. There's a piece in Star Wars called Binary Suns, which, if people have seen Star Wars, it's the point at which Luke Skywalker walks out onto the surface of the planet of Tatooine and the twin suns are setting. The music that plays in the background is Binary Suns. And that was a really emotionally significant piece of music for me because I was exposed to it when I was a young person and it was really moving. And one of the things that I tell people in therapy is whatever you use as a distraction technique has to be at least as emotionally significant as whatever the stimulus is, because it's got to take control. And so rather than try and think of a distraction technique that's equal to what the stimulus is at the time, just find whatever is the most significantly good thing that you can imagine in your world, and then use that as your distraction technique to break that connection between what those irrational thoughts are and that affective state. Because you have to get out of the affective state to be able to counter the irrational belief.
You may well be right. I don't know. I find that whole affective thing to be a challenge for me, because my conceit is that I'm a rational man, and that if I can recognize the illogical nature of my thoughts, I can logically restructure my thoughts and choose to behave differently.
So then when you started this by saying you beeped your horn because you're impatient, what is impatience?
It's my frustration that I feel in the moment.
Is that a rational thought? No, no,
it's a feeling. Yeah, and we all have feelings.
Right.
I mean, anger. Yeah. A lot of people come to therapy about dealing with anger,
right. And
which
impatience
is expressed
is really
or suppressed. Yeah. So I have those feelings. How I choose to honor them or indulge them or respond to them is defined by the man that I want to be and the behavior that I want to have. And I believe that I can choose to reduce the power of that and reduce the impact of that, even though I don't know that I can actually stop it from happening. I'm going to have that flood or surge of irritation or frustration, but I don't have to become a jerk. I don't have to drive like an idiot. I don't have to blow my horn. I don't have to give them the finger. I don't have to do any of those things. I can choose other things, some of which involves distractions. Listen to the radio, get involved in a conversation with somebody, remind myself it's a beautiful day, whatever. But to me, that's driven by a cognitive decision and a choice of paths more than a restructuring or a massaging of my emotional state.
Well, so if I'm driving and I'm mad at the person who's in front of me, and then I am experiencing an angry reaction, and I don't do anything to soothe that, and I just then say to myself, well, he has the same right to be here. I'm interjecting that thought in the midst of that negative emotion. What I want to do is create a neutral ground. So I use my distraction technique, and I correct that.
I follow you. I just don't know that I agree with you. I mean, for me, my emotional state changes when I have made what I think is a logical, more sophisticated response, the idealized response, instead of the visceral reactive response.
Okay, but would you agree? So my premise would be that if I create a neutral emotional environment, when I inject the new, more rational thought, it has a better chance of growing and blossoming and creating a different reality if I just give myself the new rational thought while I'm still feeling bad. Isn't there still going to be some visceral connection to a perception of negativism that's going to be associated with that more rational thought? That's what I want to try and do, is to erase that.
I understand what you're saying.
I think it can work.
I don't think it's a one-size-fits-all.
No, I don't. No, I don't. I agree. Yeah. I'm just explaining that that's my method of doing it, because if I create a neutral emotional environment, then when I inject that new, more rational thought, I think it has a better chance of having a more profound change.
Well, and also, there's a cognitive process involved. If you've taught your client, okay, here are 5 musical selections that have power for you. Choose among them in the appropriate moment to listen to or to imagine, to hear in your head. If they're able to separate themselves from the flood of emotions caused by the guy cutting them off long enough to identify any of those 5 songs, their horizon is already shifting. Their reality is already changing. Now, you can describe that as an emotional adjustment, or you can describe it as a cognitive process, but the outcome is the same.
Okay. I mean, I
think that's the difference.
I don't necessarily disagree with that. I think that, yes, anything that you do in that vein, even if you introduce the new, more rational thought, changes the affective state. So,
Right.
yes, I agree with that. But my philosophy is to do that, to inject a new, more rational thought in as neutral or pleasant a state as possible, because then I think the person's association is going to be positive with that more rational thought, and then that has a more profound change over time. But I agree with you. I think that it can happen either way. And to me, really, I don't really care how
Right.
people even
No.
conceptualize it.
Oh, yeah, you do.
Well, I would like to say that I don't care how people conceptualize, because I will say to people, I think, just like we're saying,
Yeah.
I think we're saying the same thing
Yeah.
using different language, maybe even a small semantical difference in the way you really put a lot of emphasis on your
Thoughts.
rational ability. I put a lot of emphasis.
I do realize that man is not a rational animal,
But is
he is
a
a
rationalizing
rationalizing animal. And
Yeah.
I am incredibly equipped to
Right.
rationalize.
And I tend to put more emphasis on the emotional
Skip that whole
affective
thing,
state.
go right to the affect. Yeah.
Because I'm, so into emotional regulation as a foundation
I respect
for
that.
Yeah. And so am I projecting my own bias onto this theory? Absolutely.
So clinically, you serve a market. Mm-hmm. The challenge of the world is for that particular subset of the market to find you.
Yeah.
If they come to see me and I don't speak their language, they won't come back.
Right.
And if they come to see you and there's a harmony there, you can do as good a job
Mm-hmm.
with them as I could do if I had harmony with them. Mm-hmm. So I'm okay with that.
Yeah.
I think that's one of the things that we try to teach people in training classes. You serve a population, whether you know it or not. Your challenge in terms of earning a living is to have that population find you.
Right. And so the takeaway from this then is that in cognitive behavior therapy, we're trying to find opportunities to challenge people's
Rethink,
Yeah.
rewrite scripts.
and then recognizing that that's not a one-time process. So you have done this in your life before, but sometimes you still find yourself becoming perturbed because somebody's sitting too long at a light. So the
It's like
goal
Sisyphus
is
pushing that damn rock up the hill. Yeah.
anytime you recognize that the process is happening, to go through your re-scripting process.
So there are different labels that are used for this. One of the more common ones that are popular in today's marketplace is mindfulness. Mm-hmm. If you are mindful, you are aware and feeling, in touch with. If you're on autopilot, all those scripts just come out and play their hand. And you observe them from the corner perhaps, or don't observe them at all. So the challenge for all of this is to learn how to be mindful and to make different choices, whether it's to listen to a piece of music, do your times tables, do finger exercises, anything
Deep
at all.
breathing.
Yeah, that you learn can modify, change that negative reaction that's caused you trouble in your life.
Exactly. And to learn how to be able to recognize the negative behavior as quickly as possible and go through that process. And in the end, what we hope happens is that the individual has a more productive and proactive life rather than a reductive, reactive life.
Yeah, what I tell my clients is you learn to recognize sooner and change faster.
Yeah.
You don't learn to avoid. It's
Right,
going to happen.
exactly.
You're going to get the flash of anger, the hurt, the fear, the anxiety, whatever the flash is. But you learn to recognize it sooner and change it at a cheaper cost.
Yeah.
And to me, that's the best you can hope for.
So, as always, if you have any questions or comments for us, you can get us at Psych with Mike. You can find us on the Facebook at Psych with Mike. You can find us on TikTok at Psych with Mike, or on the YouTubes at Psych with Mike. And if it's Friday, it's Psych with Mike.